More on the coronavirus emergency. As fears of a pandemic continue to rise, people are scrambling to stock up on supplies, prompting some stores to start rationing how much you can buy. Steve Osensami is outside a Target in Georgia. Good morning, Steve.
Good morning to you, George. For example, is what's happening at this Target in suburban Atlanta. They are out of face masks. Superstores like this one are selling out of these products online and in the stores because of the fears surrounding the coronavirus.
There's a run on supplies this morning. Big box stores across the country are seeing the growing concern over the coronavirus here in the longest lines they've seen in years.
I'm in panic because I went to Costco and there's no water.
These are pictures posted online from various Costco's and a line just as long outside a store in Brooklyn. At this Publix supermarket in Fort Lauderdale, they were doing double takes over this, seeing a shopper who was either kidding or taking the coronavirus fears very seriously, dressed from head to toe in a hazmat suit while getting supplies at the grocery store.
The end of the line for the toilet paper and paper towels is right here.
From coast to coast, even out in Hawaii, stores that were recently filled with bottled water, baby wipes, and toilet paper wiped empty.
We sold out the masks first, and then the hand sanitizer went a little bit after. I guess people are just real nervous about the potential spread.
One consumer research firm says that sales of dried beans are up 10%, thermometers are up 47%, hand sanitizer 73%, and none of those numbers take into account sales from the last week and a half. On their website, Kroger has announced that they will be limiting the number of sanitization, cold, and flu-related products to 5 each per order.
I think that's really good that they are limiting people so that people can't go buy the whole store and there's plenty to go around.
If a pandemic were to happen, the Department of Homeland Security says it would be helpful to have on hand a 2-week supply of water and food. And they suggest that you make sure your drug prescriptions are refilled and that you have a good supply of pain relievers, cold and cough medicines, and other non-prescription items. But some experts say that the run on products like bottled water and hand sanitizer might be a little overboard.
You don't need to be applying the hand sanitizer every 5 minutes. A small bottle in your purse or pocket should be fine to get you through several weeks. It's a respiratory virus. I don't see that it could live in our water supply, and so I don't see a reason to need to stock up on any kind of bottled water or water filters or anything like that. You can drink the water that you normally drink.
Some more advice from health officials is to buy food that you would feel like eating in the event that you got sick. Also, if they're out of hand sanitizer, buy soap instead. Any sort of soap will be just, if not more, effective. George.
Makes a lot of sense. Okay, Steve, thanks very much. I want to turn now to Dr. Ashton. He's been fielding questions from viewers on social media all morning. So what do you have?
George, hundreds and hundreds of questions coming into our coronavirus command center now. We're going to start with Shay on Facebook, who's asking, how are people infected with coronavirus being treated, and what are the protocols right now other than stay home? We really don't know at this point. This is, right now, if you have mild symptoms, you're being managed no differently than you would, let's say, if you had influenza. And so you want to be in touch with your healthcare provider if you have one. If you don't, you want to call your local hospital or your local health department, and they can instruct you on next steps. But because there is no treatment at this point, it's just supportive care, rest, stay well hydrated, and over 80% of people who are known to be infected with coronavirus resolve and get better on their own, which is really good news. The next great question, George, is from Instagram asking, can the virus get on your clothes? So whether it's clothes, money, we're hearing all these questions. Right now, that is unknown. We have no evidence that it can, and I want you to encourage you to think of this no differently than the influenza virus. We don't particularly worry about that getting on our clothes. However, for some viral comparison, the norovirus, that GI virus that makes people very, very sick with GI symptoms, that can actually get on people's clothes, on sheets, and can be passed that way. So long answer, but short answer, we don't know.
All right. And Jen, we understand you're getting a lot of questions online about hand sanitizer.
Yeah. And again, there are so many different hand sanitizers out there. I use this all the time in my office when I'm seeing patients. They're all over schools and workplaces. Anything with at least 60% alcohol, according to the CDC, is effective. But again, we want to encourage people, really, if you can get to a sink, Hand washing with soap and water is the gold standard. So again, when you do that, at least 20 seconds. When you're done, you guys, make sure you grab a paper towel to turn the faucet off with. Otherwise, you've just undone all your good work.
That wasn't 20 seconds. You did not wash for 20 seconds.
She was getting a rap. It's not her fault.
Thank you.
And Dr. Ashton will be taking questions on Twitter, Instagram all morning long. Send them with the hashtag AskGMA. She'll answer more in our next hour. And tomorrow night, 2-hour 2020 special on the coronavirus outbreak. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.